Okay, so here is our first session with soon-to-be Dr. Elieth Martinez and soon-to-be Dr. Erika Manrriquez. And we're going to be going off of some questions that we have prepared for today. But also feel free to, if the conversation takes us in another direction, just we don't have to stick to these questions. And as our attendees raise their hands and ask questions, we'll be happy to answer them. And so here we go. The first question is, so let's start with one of the most common questions. Tell me about a time when you were most academically challenged, and what did you do to overcome that challenge? What was the situation? What actions did you take? And was there anything new that you discovered about yourself?
Okay, so I'll answer that question. My name is Elieth. I would say that the time that I was most academically challenged was in college. One, being the first generation of my family to go to college and not understanding the different pathways to succeed in college, how to do in classes. I went from doing well in high school to, let's say, getting like a 3.0 in college. So it wasn't until I found mentors. I joined pre-medical organizations, but I think most importantly were the mentors who helped me with regards to how to study, changing my studying techniques and improving study skills and finding access to resources. So I would say the number one thing that I would recommend, and I continue recommending to my mentees, is finding mentors who they can reach out to, ask questions, and present those challenging situations to them, and what they did in those similar circumstances. So it wasn't until that time, and then afterwards, until that I started to succeed in doing well academically, which leads to the next thing, and applying for scholarships and applying for medical school. And even during medical school, as Erika can attest, one always needs mentors to continue succeeding. It's hard to do it on your own.
And Elieth, what would be your suggestions for finding those mentors? Like, how would you approach someone that you need to mentor you, but you're just not sure about how to go?
Yeah. So there's different kinds of mentors. So there are mentors who you meet, let's say on a conference, for instance, like the LMSA conference or some of the Czech conferences. So there are one-time mentors where these workshops can provide access to these individuals who, for instance, who may serve as a panelist. So, and the panelists are there because they want to help and because they want to reach out to students. So any of the panelists there will be more than happy to, provide a hand. So that's one way, and also making networking and having that contact information with the mentors. Another way is just joining a pre-med organization, which is linked to usually, for instance, it could be a medical school, a pharmacy school, and that's a different way of providing mentors. And then another set of mentors is like your professors, so individuals who may actually be teaching a course, they can serve as mentors too, who have more like a bird's eye view in terms of a career that you may want to choose. So there's different ways.
Cool, thank you. All right, so we're going to turn it over to Erika. And Erika, the next question is, I would also like to explore social challenges, if any, that you may have faced. What were those challenges like, or if there weren't any, what was it about your mentality to not have faced those challenges?
I think that's a great question. There were lots of social challenges, and honestly, I don't know that there's anything you can do mentally that will prevent challenges like that from happening, at least if there is something, I haven't discovered it. But I think for me, the biggest social challenge was when I started medical school after graduating from college. And I think, like college, I went to we all went to the same.
Oh, we all went to the same one.
Yeah. I went to a big public university. There's a lot of people that were different from me there, but there was also so many people that I was bound to find, a community that I identified with. And then I think starting UCSF, the community shrinks a lot. UCSF is still faculty, alumni, the community in in broad terms is very large, but your class size is much, much, much smaller. You know, you go from like 10,000 people to like 150, and I had major, major culture shock. And yeah, I had been very involved with the Latino community, folklorico community at UCSD, and I just didn't, you know, my options were much fewer in medical school, and I think I was used to having that familiarity around, you know, feeling like I had people around me that I identified with more on the order of like, you know, cousins or family than classmates. And you know, when I started, I just didn't have that same support or comfort. So I think that I really struggled with that. And, you know, I eventually was able to grow a community that sort of served that same purpose that I'd, like, you know, the same way that I'd had in college. But it was a lot smaller, and you know, our time was just busier and more occupied, so it was definitely an adjustment. So I think that was the first major social challenge I faced. The second was definitely, you know, I think a lot of medicine is still a conservative profession, and so there's lots of, you know, there is still a degree of sexism and racism, unfortunately, even in liberal cities like San Francisco, and I think I was not expecting that, being in the place that I was, and it took me really off guard. You know, I think I had some interactions when I started clinical work, my third year of medical school, people saying, you know, really inappropriate things to me about, you know, just based on my race or my gender, and it really, you know, you're already in a vulnerable place, feeling like, oh, I'm not sure if I have what it takes to do this, and then, you know, someone who should be a mentor role, even if they're not your official mentor, saying things like that to you can really, like, throw you back a lot. And I think you have to have a very strong sense of self, or probably people around you who will help propel you forward when you're having a lot of that self-doubt. And I think that happens to everyone for various reasons, but I think minority students probably disproportionately more than non-minority students. So those were the two big ones that I faced.
And Erika, what advice would you give yourself now that you're a fourth year to yourself as a first year when you were coming across those challenges?
Yeah, I think honestly for me, in multiple aspects of my life and what I've realized in medical school, it's all about expectations. So I wish, you know, I don't know that there was a way for me to have these expectations because I didn't really know anyone in medical school before I started. But I would just pass on the advice to entering first years or people applying to med school that your environment changes and you may not have the same community that you were used to in like your college or your job from before, you know, if you live in your hometown, it's going to change. And so to just mentally prepare yourself for that change. And I think there's always adjustment for everyone, but at least if you have that expectation there, it's less sort of jolting. And the second thing would be to not take it personally, like in terms of, you know, people say things that seem, you know, like we call them microaggressions or even macroaggressions. People say things to you that seem like they're condescending or that their expectations of you are lower because of your race or your gender or your sexual orientation, whatever. Don't take it personally. That's a reflection of their value system and their beliefs. And, you know, luckily enough, now there's lots of examples, lots of role models for us of women, minority women who have made it, and so it's definitely possible, and you know, not a reflection of your race or hometown or gender or whatever, a reflection of really of the person saying the things. So don't take it personally.
Absolutely.
Yeah.
Great advice, Erika. Thank you so much. So Elieth, we're going to come back to you.
Okay.
All right. So click. There we go. Okay. So question number 3. Did any of you have, or did you have any family, friends, significant others, or did you have any challenges with family, friends, or significant others? If so, what was your takeaway message, and what would you advise someone going through a similar situation? And if the question's not clear in and of itself, what I'm trying to address is the challenges that students might come across when going through professional school or any school with, you know, dealing with family or friends or significant others, and what would be your piece of advice as to how to handle those situations?
Okay. Let's see. So So first of all, I think it's very hard to prepare anyone for what they're going to be expecting in medical school. You know, as much as you may say to someone you're going to be studying a lot, spending more hours in the library or more hours in the hospital, it's hard to conceptualize that until you actually go through it. So I would say that some of the problems or issues that me or peers around me experience would be, preparing, for instance, like preparing their family members or significant others for that time away. As a student, as a student or as a resident, or even as like a practicing physician, dentist, pharmacist, you don't have that leisure time anymore. And so I think that's one of the challenges that all professionals face is how to provide that space and how to provide that time. So having someone who's understanding, or including the significant others or family members in, for instance, like activities, so that the other individuals may understand like what you may be going through or what the different expectations are. So I think it would help to prepare the other individuals in terms of, hey, I'm not going to be having as much time, or I'm going to be spending a lot more hours in the library. But I think having that, setting up those expectations and providing that space, and also setting up time, reserving that time aside in order to also preserve that relationship with, whether it's like with your family members or significant others. So I would say that's probably one of the main challenges I saw in medical school.
Thank you, Elieth. Erika, do you want to add anything to it, or?
I think this overlaps a little bit with the next question, so I can save my input for the next question. But I echo a lot of what Elieth has said, definitely.
Okay, so we're going on to the next question. Reflecting on past classmates that were on the same path as you to become medical doctors, but didn't make it, why do you think that was? Was there something they could have changed? For instance, choices they made, being more or less involved in extracurricular activities? What are your thoughts?
Yeah, this is tough. I think everyone's different, and I know several people who sort of started on this path and then changed their their trajectory for various reasons, and like it's different for everyone. But there were some trends that I think are important to acknowledge, especially for people that are sort of at that branching point trying to decide if this is the way they want to go. And I think the first one really is misinformation. So sort of hearing through the grapevine that, oh, this is how things are, like women can't have families if they become doctors. I had actually several Latina friends that decided to not go to medical school because they said, well, I want to have kids, that's important to me, and so I don't want to go to medical school. Which I think, it takes anything nowadays. I think, any working woman has to think extra. Unfortunately, that's just like a difference between men and women still at this point, but has to think extra about how she's going to balance her life. And that's no different in medicine. It might take a little extra, a little more than the average job, but I think, anything you choose to do nowadays, if you want to work, it takes extra planning. And women, I mean, by and large, the women that I know in medicine all have families. There are certainly women that choose not to, and that's their decision for their own, personal fulfillment, but by and large, women have families and can make it work. So I think, and misinformation also about what it takes to get into medical school, that if you don't have certain grades or numbers on test scores or certain extracurricular activities, like you have no shot. And I definitely fell into that trap a little bit reading like Student Doctor Network. I highly advise against that, because there's a lot of, people will say things that they think they know and they're not necessarily true. So unfortunately, I've seen people change career paths for reasons that aren't true. So I think it's important to get your information from valid sources, which is tough, but I think this is I think this is one of the reasons Deep Talk is so important, because we're going through it now and we can tell young people things that are true. But be careful where you get your information. And the second reason is sort of related, but family expectations. Parents, and these tend to be more traditional families that expect, and again, this happened to affect more women than men that I knew, but you expected the female to, get married, younger, have kids younger, have more household responsibilities, and for them, the pressure was so much, it just didn't seem like it would match up with a career in medicine or more schooling. And so I think that's tough too. And I think people ask what challenges minority students face more than non-minority students. I think that is one of them, because although it's not true for anyone, I think in general we tend to have more traditional, a lot of the immigrant families are more traditional. If families are religious and more traditional, they have the more traditional like gender roles kind of permeate, and so it can be tough. And luckily that's not been something that I've struggled with a ton, a little bit, because my partner, who's also in medicine, his family is definitely more traditional than mine, and so I've struggled a little bit with their expectations of my role. But yeah, I think those two are big reasons I've seen people choose not to go into medicine. The other thing is, I think there are several related fields in healthcare that are equally fulfilling depending on who you are. Physician assistants, nurse practitioner, pharmacy, dentistry, nursing. There's lots of things, and I think the roles are very different. So I would encourage people to explore thoroughly all of the options to make sure that whatever you choose is right for you. I think they're all require a lot of work and a lot of investment, and so I wouldn't choose one because it seems easier than the other, because I don't think that's necessarily true. But definitely, get your information from valid sources, and if you're having family expectation issues, reach out, because I think a lot of us deal with that, and find ways to have those tough conversations with our families. It's not impossible.
Cool. Thank you, Erica. Let's see here. Okay, so the next question, I want to put it out to both of you, whomever wants to get it first. If you could go back to your college years, what piece of advice would you give your younger self?
But yeah, that was a long time ago. I would probably tell myself to, I would say, do not be discouraged. I feel like that's one of the main things that a lot of like pre-medical students in college, or even as one does like a post-baccalaureate year, or even afterwards, like there's a lot of discouragement in terms of applying in any health professional field, whether it's like the misinformation that we're getting as students, like Erica clearly pointed out, having like low GPAs, or an MCAT that one may not think it's competitive, or the different clinical research skills that other people have. There's a lot of comparisons that students do with one another, and that can lead to a lot of discouragement. However, when as an applicant, every applicant is an individual and adds a different flavor to the class, as we see in our own classes. So I would tell myself to not be discouraged, and to find those mentors early on, because they are the ones who are your cheerleaders on the side, and who actually see your full potential when you're deep in the studies, and all you can think about is like the next exam. So for instance, when we start mentoring students, and students come to us with, it's so interesting, like I will go to the LMSA conferences or the Prime conferences, and we're on the table, and we always get students who clearly remind me of myself when I was in the pre-med days, of saying, oh, hi, I'm really, very interested in medical school, but this is my problem, and so they come up with like a laundry list of problems of why they think they're not competitive enough. And I remember me myself doing that exactly, and just trying to find some sort of light, or confirmation or affirmation from whoever I was talking to, and like it was nice to have them let me know that, okay, this is what you need to do, and you'll be fine in the end. So that's one of the biggest pieces of advice that I would tell myself in my college years.
All right. What about you, Erica?
Yeah, I think sort of related, but a little bit different. I just did an admissions panel like a month ago, and I had some students come up to me and say, I'm really worried, especially, and this is particularly prevalent in the post-bac communities. The group of students is much smaller. There's a lot more talking between each other, or like the pre-med organizations and undergrad. Everyone does a lot of talking and sort of looking over the shoulder to see what everyone else is doing. There's a lot of, people get worried. It's like, oh, my classmate has this GPA. Word on the street is that, like, I shouldn't even apply to these schools because I don't have this GPA, or I didn't do any research and everyone else did. My main advice is really do you. I think there's a lot of generalities made about who gets into med school and who gets into what medical school, and really, that you have to do the research, you have to get this score on the MCAT, get a certain GPA, have done like X volunteering or X clinical hours. And I think it's like I sort of, I remember thinking those same thoughts, but it's sort of funny now being on the admissions committee, and it's so variable. People that have done exactly that laundry list of things, and we have people that have done almost none of those things, and everyone has their own story. And so I think you really need to do the things that you're passionate about. And while you need to have you need to be able to articulate a reason that you think healthcare, medicine, dentistry, pharmacy, whatever is right for you, it doesn't need to be my whole life has been leading up to medicine, because that's not, I made the decision to come into medical school the year before I applied. So all the things leading up to medical school, all the things leading up to entering medical school did not necessarily fit together. I did a lot of things that were totally unrelated, and that's fine. That gives me a lot of, different perspective, a lot of things that I can bring to the table that are different from my classmates who have done other things. If you love art, do art. If you love writing or technology, or you're a community organizer, or you do really love research, great. Like, do whatever you're really passionate about and try not to compare yourself. I actually was not a part of any pre-med organizations because it made me like a little crazy, because I couldn't help but compare myself to all the other people and get like really freaked out all the time. So I didn't do any of that. I sort of got my information online, and that just helped me sort of stay true to myself and not try to be someone that I wasn't. So just stay true to yourself. Don't try to be what you think is the ideal applicant.
Great piece of advice, ladies. Thank you so much.
Yeah.
Last but not least, and I want to ask this to the both of you as well, and we can start with you, Erika, since you're already up. Where do you see yourself in 5 or 10 years? Can you describe some of the actionable steps that you will take to get there?
That's a great question that I maybe don't have a full answer to. So I'm starting OBGYN residency in June, which is 4 years. So that'll be taking up a lot of my time over the next 4 years. I think, so I'm interested in GYN oncology, which is accredited fellowship through the National OBGYN organization. And what that is essentially is subspecialized training after residency. So the 4 years that I'm about to do are general OBGYN. And I could, if I wanted to, I could totally finish residency and get a job as a general OBGYN. Most people do that in, at an academic institution like UCSF or UCSD or UCLA, or at a community place like one of the Kaisers or community regional in Fresno. But I am interested specifically in cancer surgery for women, so that requires extra training. So that's another 3 years. So in 5 years, I will probably still be training, which is great. And I think, in terms of actionable steps to really get anywhere, whether it would be to a job or to matching and fellowship, really fostering relationships. I think that's, residency, a lot is already scheduled for you, and you don't have much decision over the rotations you do, and the work that you're assigned to, because you have to do certain things to pass, essentially, to get licensed. But there is some leeway in what research I do, what relationships I foster, who I look for as a mentor. I'll probably choose people within GYN oncology, the subspecialty I'm interested in. I will probably try to attend some conferences, try to do a little bit of research. Even though that's not my primary interest, it's important for people to see that you are at least attempting to investigate, the subspecialty that you're interested in. Yeah, so I think a lot of networking, fulfilling my responsibilities as a resident, and doing a little bit of research probably to get to my fellowship goal.
All right. Well, we wish you the best of luck. Thank you. All right, Elieth, you're up.
Let's see. So I'm going to be heading to Duke for general internal medicine. So that's a 3-year program. Let's see. And then afterwards, I'm planning to work for a year, save up money, pay off my student loans, and then I'm actually interested in working in the ICU. So the ICU is the intensive care unit, and you tend to I just want to work with like the sickest patients that show up in the hospital, and a lot of that is managing patients who are in their end of life, having lots of conversations with family members in terms of like decision making processes, managing patients who are intubated, basically like if they can't breathe on their own, who have severe infections, and figuring out what the infections are. So that's another 3 years. So in 6 or 7 years, I will have hopefully a finished residency, and I would like to work in an academic institution, mostly because I enjoy mentoring and teaching and working in group settings. And some of the actionable steps is very similar to Erica. Lots of networking, finding those mentors that we kept emphasizing throughout this conversation, finding those mentors early on of residency, and getting them involved with different projects, different organizations, and of course continue mentoring too as a resident.
I have another comment.
Yes, go ahead.
Really quickly. So I just want to make sure we comment also on, just because I was making this point earlier, personally in 5 to 10 years, I would see myself being married probably in 10 years with a child or two, and I think that's an important thing to add to the conversation, because even though Elieth and I are both talking about our career goals, we have personal goals also, as do most people in medicine, and actionable steps there look very much the same as they do to someone who is not in medicine. Maintain your relationship, lots of open communication. My partner will, happens to also be in medicine, so will be a resident like myself. Lots of balancing of time and responsibilities, and making sure that I prioritize our relationship, my relationship with my family, in addition to my career. So that's an equal set of goals that I have to moving forward in my training. Just wanted to add that.
Great. Thanks so much for adding that.
Yeah.
And Elieth, we also wish you the best of luck in all of your future endeavors.
Yeah.
Do you
we should actually watch this 10 years from now and see if anything happens.
I know.
And come back and have another session. Is there anything else that we didn't touch upon that you guys would like to touch upon? Anything else that sparked anything? If not, that's okay.
I mean, I think, like I said, I think we're lucky, because even though minority students face a lot of extra challenges that non-minority students don't, like I said, there's lots of role models now. And I think like this organization is a great example. So we're here and happy to answer questions and be mentors. And there's only the two of us are on this podcast, but there's plenty more where we came from. So I think like don't be afraid to reach out and ask for help. We've done it many, many times along the way. And sometimes you get told no, but at least I know for us, you won't get told no. We're happy to help. So don't be afraid to reach out.
There you go. And then one other thing that I wanted to bring up, which I didn't want to interrupt Erica because she was on a roll.
Sorry.
No, that's great. So you were talking about when you not feeling attacked, but like when people make comments that are not very welcoming, and how do you deal with them? Me personally, what I end up doing, as you mentioned, not to take it personal. And this goes back to a book that I've read not too long ago. It's called The Four Agreements. And in this book, it's very short, very brief, but it really, and at first I kind of thought, what is he talking about? But as I was going through it, I was slowly reading through it so that I could really implement some of the things that he was talking about. And that was one of the things, to not take personally what other people are saying, because what other people say or do towards you is a reflection of them and not necessarily a reflection of how they think about you. So something's going on in life that they need to address. In sort of the spirit of the three of us being in here and having this conversation, the other book that I've come across is called The Secret Thoughts of Successful Women by Valerie Young. And I don't know if you guys have heard about that one, but in this particular book, she talks about all of the sort of issues that women go through, and why is it that sometimes it might seem that men think that they are better when in reality we all have the same skill set. It's just a matter of how we present ourselves. So I just wanted to just briefly mention that. But anything else, ladies? Okay, sounds good. Well, thank you so much for joining in on this broadcast, and I hope that we might get to revisit this. I know that you guys are going to be really busy, but definitely in time from now, we'll revisit this again. So thank you very much for joining us, and I am going to stop the broadcast. Thank you so much.
Thank you.
Thank you.